And as COVID-19 cases continue to rise in the province, doctors are sounding the alarm over just how much Ontario intensive care units can take. As of today, there are 400 COVID-19 patients in ICUs. In the past, health officials had said once that number exceeded 350, we'd be headed into dangerous territory. A warning sign that the next couple of months could be tragic. The province now surpassing a key threshold for ICU care. And there's worried this is just the beginning, with health officials predicting the number of COVID patients who will need critical care could reach 500 by the end of the month.
It's unless something changes, and at the moment it doesn't look like anything will, we will probably eclipse the province's critical care capacity by the third or fourth week of February.
And if that happens, hospital care as we know it will have to shift in a big way, with patient access to life-saving procedures such as cancer care, cardiac care, or other treatments that are made to improve one's quality of life will be pushed aside and crowded out.
So you'll see a colossal amount of unnecessary death and suffering. You'll see situations that we thought, couldn't ever happen here.
We are looking at being severely overwhelmed. We've seen numbers in the last 2 days that are record highs. We have exceeded the number in the ICU of 350. That was the magic number, at which point we overwhelm our ICU resources.
The province has issued a request and guidance to the entire hospital sector to be on standby, essentially to act as one single solitary health system so that patients could be transferred between facilities. But epidemiologist Colin Furness says the province should be doing more.
The wisdom in Ontario is that testing is not what we do. In Ontario, we lock down or we open up. That's the toolkit. I disagree. I think that we could and should be testing. Not only that, there are innovative tests that are excellent that we're ignoring, we're not using.
Furness says Ontario should be looking to countries like Slovakia that contain the spread of COVID-19 with mass testing. But as we continue to see an influx of ICU patients, and with projections showing the situation will get much worse, doctors fear we could see those horrific scenes like we saw last year in Italy, right here at home.
I'm not trying to scare people here or inflate this, but the situation in this province has never been more serious than it is right now. And there will be a terrible human cost beyond what the province has paid already, beyond what our society has paid already.
I remember the pictures that came out of Milan and New York. We can't afford to lose nurses. We can't afford to lose PSWs. We can't afford to lose doctors right now. Having those people able to work in the hospital, having those people protected to continue to provide care will decrease our losses in the rest of the population.
Several Toronto area hospitals announced they are closing their pediatric wards to help create adult inpatient capacity. Meantime, the Ontario Medical Association is stressing the most important thing we can do to preserve lives is to get the vaccines in the arms of Ontarians.